constituents. Our logistics team averages this week about 1,000 emails back and forth from our partners, coordinating much needed resources. And in our EOC here, we've got about 23 partners in the room in a emergency operations center that typically hosts about 98, but doing proper social distancing here and only having the most essential partners in the room to make sure that we respond effectively but safely. No matter what we are doing, though, however, the most important thing that's going to determine how successful we respond to the new coronavirus is what individuals do themselves and what's happening in the community. So we're trying to set the example here. So some things we're doing here at the Harris County Office of Homeland Security and Emergency Management with our team and our partners to make sure that we stay safe and healthy. First, before you even get in the building, we have a screening process where you're asked a series of questions ranging from where you've traveled to recently, if you're exhibiting any symptoms, if you've been exposed to somebody that is potentially sick or is showing those symptoms. And then we also take a temperature before you're even allowed into the building. We're reducing the number of partners that are in emergency operations center. As you can see in the background, typically for a flood or a hurricane, this room would be packed. You'd see a lot of people going back and forth, every chair taken. But we're limiting it again today to only 23 folks in the COC from our most essential partners. We've also divided our team here at the Emergency Management Office into two. While one team is working remotely, the other team is here in our Emergency Operations Center. Then we rotate, and on Sundays, we all work remotely, making sure that we minimize any exposure to the full team, and again, trying to keep us safe and healthy. We're asking our partners to do the same. So our teams of those partners that are housed with us here are also separated into Team 1 and Team 2 to make sure that we try to not expose as many people as possible should one of us become exposed to the novel coronavirus. So the facility is also cleaning each night when we go home. And again, a good solid cleaning on the weekend. But aside from that, multiple times a day, the facility is being cleaned and wiped down and disinfected. We're also aggressively enforcing social distancing whenever possible. And even for team members that are here on site, strongly encouraging and whenever possible, having those calls done by phone or virtually rather than having face-to-face. And also critically important that we think is vital is empowering each of our members of the Office of Emergency Management to be their own advocates so they can stay safe. And so giving them the ability to social distance as they see necessary. And some are being creative. If you were able to walk around this office, you would see some doors with sometimes humorous signs saying, "This is the 6-foot distance. I can hear you from here," or a reminder about social distancing, just so that we can enforce that. It's a new time. It's a new culture that'll take time to sort of take root. I'm sure those are some of the same challenges that are happening in other workplaces and in homes across the county. So that's what we're doing. Glad to take any questions about what we're doing here at the office or what you can do to stay safe and healthy at home.
Francisco, we have a question here. What is the biggest challenge for your teams who are working remotely?
Some of the biggest challenges are what you're facing at home. You may not always know what exactly is happening at this office because you don't hear it in the hallways. You're not sitting in person in the meeting. You're not part of that sidebar conversation. So we're trying to figure out how to learn that gap. And then some of the very real things that are happening out there. Sometimes the internet is unstable. You've got everybody at home. So someone's streaming TV, streaming television. You've got another person in your house that is playing games or something on the internet. So when you're trying to do a Zoom or you're trying to have a webinar, you'll get that pop-up that says the internet is unstable. So those are kind of the very real things. And like anybody else, we're seeing barking dogs in the background, cats running across a computer screen. So some of that is just the very real things that you're facing at home as well, or the same kind of challenges that we're facing here. But the biggest thing is communicating, keeping those lines of communication open. And that's something that we're trying to do.
Next question comes from Adam Bennett at KHOU. What is the biggest challenge facing your office related to the COVID-19 response?
Good question, Adam. And I'll reiterate, no matter what we are doing in public health, in emergency management, at the city, county, state, or federal level, We are doing everything that we can to share information with the public and with our partners, trying to get the critical resources here, trying to adapt to information and realities that change. But no matter what we are doing, the most essential thing to this is what individuals do. No matter what we do as government or as health professionals, our success to fighting the new coronavirus really depends on what people do as individuals for their social distancing, and what we do as a community to abide by the orders, not just what we are told we can or cannot do, but going the extra step and making personal decisions that prioritize health and safety and going above and beyond that and doing what is responsible and what is right.
Our next question comes from Maya Shea. Has any OEM staff been tested, and what are the results?
I am not aware of any of our team members having been tested. So far as I know, that has not been the case. I know we've got various government employees throughout the region that have been tested, and some that'll fallen ill. And that's just a reminder for us to continue to practice social distancing in our office, to have the processes and protocols in place. And it doesn't mean that we can't be exposed out there in terms of the normal course of business. It doesn't mean that we are entirely safe from that. It just means that we are trying to put up every possible barrier to do that. And I think that, again, the most important part is we're trying to instill a culture in our team that your health, your safety is your responsibility. You are essential and we need you here, but do what you need to do to stay safe. We're encouraging people to be creative about that. And if we see something that's working in the workplace, for example, like those signs on doors saying, hey, this is 6 feet, no need to come in, I can hear you from here. Those kinds of things we're encouraging. And it's really a culture shift. And our hope is that our team will continue to be safe. And if testing is necessary for somebody, then that'll have to happen. But right now, I'm not aware of anybody.
Our next question comes from Mark Fleming at the Baytown Sun. What is the Harris County position on drive-in worship services with Easter approaching?
Sure. The faith-based community has been absolutely critical to this response. And well beyond any local order or any state order, you saw a lot of faith-based community leaders canceling services. And we're coming up on a time where we've got Easter, we've got other holidays coming from a wide spectrum of our faith-based community. And so we have some guidance on readyharris.org from the Texas Attorney General on what the governor's most recent order means in terms of faith-based services. Drive up, for example, is an option. It's one that's listed in there as an option. More details are available on readyharris.org. The critical thing is this. Just because you can do something doesn't mean you shouldn't. This is a time of sacrifice to make sure that you personally stay safe, that your fellow parishioners stay safe, and the community stay safe. There are some creative ways to do that, and I think we're going to see some of those drive-in services where people stay in their car and still practice some distance. It is certainly one option. There's one church in town that's going to have a service where it's drive up, you don't get out of your car, but they'll be projecting something on the screen, sort of like an outdoor drive-through, to be able to see that service and worship that way. That's an exciting idea. But again, there's some logistics to that. You can't do that in daytime. You can't do that at 10 a.m. because the screen won't project. So they're doing like an early sunrise before the sun comes up. So that's one way. I will caution this. You still need to always maintain at least 6 feet of distance. So, communion services, which, can be problematic. The number of people that you have to facilitate that kind of creative worship service, again, less than 10 is the CDC guideline, and a minimum of 6 feet distance. So that's a little bit of help, hopefully, for our faith-based partners that are trying to enter some of this holy season in ways that are practical. But again, virtual services, online services always provide the most secure environment.
Our next question comes from Charlie Editsy at AB13. Is the county going to recommend wearing a face mask?
There is no current county recommendation about a face mask. There seems to be sort of conflicting signals at the moment in terms of what that guidance might be at the federal level. We are following the science, and right now there are a lot of the science, as we have been told, does not recommend that at this time. And then there are other questions that would have to be answered. Are we talking about an N95 mask? Are we talking about a surgical mask? Are we talking about masks of other standards? Are we talking about that just for essential employees? Are we talking about that for people in the community? As you know, right now there is a significant shortage of masks at any of those levels that need to be in the hands of our healthcare providers that are providing critical services. And I will tell you firsthand, I have witnessed the capacity that's out there, and right now we simply don't have enough of that to go around for what people would like. So those are the kinds of considerations that would need to go in place before we make any kind of decision on that.
Francisco, this will be our last question from Maya Shea again. Are 2 county sites open this weekend?
That I'll have to get with our public health team. My expectation is they are, but let's verify that, and we'll get you an answer, Maya, shortly from our public health team that is leading that effort. Great. Thank you, everybody, for joining us on this. Again, just a little bit of advice. The most important thing in this response is not what we're doing, but what you're doing. Social distancing, a minimum of 6 feet, and don't let your guard down. I know we've been at this for a while, and we've got a little while to go, so don't let your guard down. Only leave home when it's absolutely essential for groceries, to get critical supplies, pharmacies, medical care. Those are obviously good reasons to leave. Be flexible, be creative. Remember, information on this changes. Visit readyharris.org regularly for information, or follow us on Ready Harris on our social media for updated content throughout the day. And you can also text CV19 to 888-777, and that will get you information directly to your phone by text. So thank you very much for joining us, and we look forward to continue to work for you to keep you healthy and safe. Thank you.